Hi, I'm Debbie Jelks. I'm the Director of Rehab Services at Henry County Medical Center. October is Physical Therapy Month, and during October, physical therapists like to encourage people to be more active and be more involved in their health. The Department of Human Health and Services has stated that more than 80% of adult Americans do not get enough physical activity. So that means more than half of the adult population have chronic diseases, which equates to about 117 million people. And this is despite all the research that's available that tells us how much we can gain from being physically active. It helps improve our bone health, it helps improve our cognition, it helps our quality of life. So there's so many things that we can reap from being physically active. Barriers can be small or large, they can be real or perceived, that prevent us from being physically active. So I'm going to go over about 10 different barriers that patients and people just tell us, physical therapists, that prevent them from being as physically involved in an activity as they really need to be. So the first one is, it's too late to start a physical program. I'm too old. I've been inactive for too long. Studies show that no matter what age you are, you can still reap benefits from beginning a physical program, physically involved program. So no matter what level you are, what age you are, you can still see an improvement in cognitive function. You can still improve your quality of life. You can see chronic diseases improve. Number two, it hurts when so pain is a problem, and that is a real problem for a lot of people. But there are things that we can do to help you learn how to move without being in a lot of pain. Pain is the number one reason people go to see their doctor. So if you're having a problem with pain, check with your primary care provider, and a lot of times they can refer you to a physical therapist, or you can go see your physical therapist, and we can help you get into a program that will help you become active. Our bodies are made to move, and so we need to move them, and there are too many benefits that you can achieve with being physically active. Number three, I don't have time. We hear that all the time. And we even know that ourselves, that it takes time to be involved in a physical activity on a regular basis. But research also shows that if you feel like you really don't have like 30 minutes a day to devote to a physical program, if you break it up into like 10-minute increments during the day, that you can reap the same benefits of doing like a total altogether 30-minute program. However, you need to make sure that during that 10 minutes of time that you increase your heart rate. Number four, I don't have a gym membership. I don't have gym equipment, exercise equipment. You don't have to. Gym memberships aren't for everyone, and those classes aren't for everyone. So at home, you can just dance. You can just use cans for free weights. You can walk. Just walk up and down your driveway. Do chair aerobics in your den. Get online and follow an exercise program on YouTube, something like that. Personally, I like to walk and I like to do yoga in my own home, and that's what I do. So, because I don't have time really to go to a gym or do things like that. So that's what works for me. Number five, I don't like to exercise. Well, that's something we hear quite a bit. And sometimes we just have to kind of be really creative in as far as how we want to exercise and what we want to do. But that's another time you may want to talk with your physical therapist or someone to help you figure out how to exercise, because our bodies, again, are made to move. Our bodies are not made to be sedentary. And when you exercise, we release endorphins that make us feel better and boost our energy levels. And sometimes that makes us feel so much better that we do start to like exercising. But we really do reap so many great benefits, and it helps decrease our stress and increase those energy levels that we do feel a lot better. Number six, I can't get motivated. I just don't even know where to begin. So if you can't get motivated, sometimes it's helpful to like set a small goal. Like I walk today before I turn the TV on. I walk 3 days this week, and then I'll go purchase a small something that you've been wanting. And make it easy for yourself, or make it a little bit harder to not walk that day after work. Like set your tennis shoes out by the bed when you get home, or before you leave for work that day. So when you get home, they're right there and reminding you, yes, I promised myself I was going to walk today. So I'll do that. So try to set little goals so that you will kind of get a little bit more motivated. And remember the great benefits that exercise is going to do for you. The stress decrease, it decreases anxiety, It improves your cognitive function. There's so many things that being active can do. Number 7, I have a chronic disease, condition, or disability. Movement is crucial for everyone, and everyone deserves to have some kind of activity program that they are participating in. So if you're in a wheelchair or use an assistive device, there's still a program that you can follow because it is just imperative that you still move as well. Again, this is a place that maybe your primary care provider or really your physical therapist can help you figure out the right program for you. Number 8, I'm afraid of hurting myself. So if you really feel that this is a barrier for physical activity for you, again, this is where your physical therapist can come in and help you if you're really fearful of injuring yourself. Because again, everyone deserves to move and everyone can move and be involved in some kind of physical activity. Number 9, I'm out of breath when I'm exercising or when I move or when I walk. So that's okay if you're a little bit out of breath when you move and exercise, because you should be, because your heart rate goes up. And if your heart rate's not going up a little bit, then you're not taxing yourself enough. Now, if you have a cardiopulmonary issue or some things that have been going on that you need to get checked out by your physician, that needs to happen first before you jump into an activity program. But when you are exercising, you do need to be out of breath a little bit in the beginning, especially to make sure that you are working hard enough so that you can reap the benefits of your activity. Number 10, I'm tired all the time and I have no energy to exercise. Well, research shows again that exercising boosts your energy levels. It increases the blood oxygen level, which then goes to your muscle tissues and all the nutrients that goes to your blood, and you're just going to feel so much better, and then you're going to have more energy. So physical activity is just a huge component and needs to be a huge component of everyone's lifestyle. And so I encourage you today to really think about what activity level that you're currently performing, and if you're not, hopefully this will encourage you to do so. So for years and years and centuries, this has been something that's been commonly discussed. And it's really interesting that back in the 5th century, that even some of the Greek philosophers were talking about this. So I'm going to end with this quote from Plato, who was a Greek philosopher in the 5th century, because he was even talking about how important it was to be physically active and to move. Because Plato even said, lack of activity destroys the good condition of the human body, while movement and methodical physical exercise save it and preserve it. So thank you so much for your time today, and keep moving.